I'm going to demonstrate how to perform maintenance on our CVC machine. So here you're going to go to maintenance, you're going to go to cleaning, you're going to wash head cleaning. Now what you're going to do is you're going to wipe the wash head I usually use a Kim wipe. You're going to use a little bit of damp Kim wipes, that way you can wipe off any of the salt and blood that's been on the wash head from previous tests that have been ran. I'm going to be demonstrating how to do an ELISA snap test. So, of course, you're going to need your snap test. Okay. So first, we'll get our snap test out of here. I'll grab my pipette. You're going to get 3 drops of your blood. So 1, 2, 3, perfect. And now 4 drops of your conjugate. So it's going to be 1, 2, 3, 4. Perfect. I'm going to close this. You're going to invert it 3 to 5 times. Now I'm going to pour this all out into your sample well here. That's where you're going to pour all of your sample in there. And once it gets past this and into the circle here, that's when you're going to snap the test. So it's going to be hard to see a little bit because of the camera, but okay. So now it's going. You can kind of see here. Now I'm going to snap it, and then we'll see our results later. Alright, so it's been about 8 minutes now, so now I'll show you the results. So as you can see right here at the top corner, this is the control, the positive control. So if that's the only dot that's on there, then they're negative for everything. And they're good. The patient's perfectly fine. I'm going to demonstrate how to do a modified Knots test. So what a modified Knots test is how to detect microfilaria. It's one way of many. So there's 1 ml of your blood, anticoagulated blood, into here. And then you're going to get your 9 mLs, 9 cc's of 2% formalin. Gently invert it. After this, we're going to put it into the centrifuge at 1500 RPMs, rotations per minute, and you're going to have it in there for 5 minutes. So basically what you're going to do now is take the supernatant out and don't disturb anything that's at the bottom, because that's what you will be using to put onto your slide and to stain with the new methylene blue as well. So now I will get my new methylene blue, and we're going to take 1 drop and mix it. One drop. Let that go to the bottom. We're going to close this just in case it spills out, but we're just going to gently mix. So now what we'll do is we'll try to get a sample of this. Sorry. I'm just going to pour it into a red top tube so it's easier for me to get it. Just one drop onto the slide. Then I will get the cover slip, and then I'm going to go look at this under the microscope. Start at your lowest. I do not see any microfilaria, so this patient is negative for heartworms. That's how you do a modified MATS test. Okay, so we're gonna get a free catch urine sample from Jesse James here. So when you're getting a urine sample, you can always get a cup with a ladle, so that way you don't get your hand very close to their urine. Any bacteria that's on your hands, if it runs into your hand into the sample, it can give false information for the sample when it's sent to the lab. Also, when it comes to getting a urine sample, you want to keep them as close as possible to you so you can get the urine right away and not miss any. But when you do get your urine sample, you're going to do it midstream, because if you start getting it right away, any bacteria that could be on them could go into the sample, so you're going to get it midstream when they start urinating. So we're going to go ahead and get a sample from Jesse James. Let's go in. Come on, Jesse. So that's all he gave us. But usually when they have a full bladder, you can get a lot more. But notice how I started a little bit after he started urinating, and then I got just a small bit of sample. But of course, you'll need more to send out to the lab. But that's how you get a free catch sample from a dog. I'm going to demonstrate how to get urine from a canine, and we're going to do a cysto sample. So what that means is we're actually going to get a syringe and needle, and we're going to go into the bladder, and we're going to draw it out, so that way no bacteria interferes with the sample, because we will send it out and get a culture done on it to the lab. And Nibbles actually has an interesting case here. So her bladder, if you were to feel it, it feels kind of sandy to the touch. It feels as if a balloon was filled with some rice. So we're going to do a culture, and we're also going to do a urinalysis on her. So we're going to get our sample. So of course you'll need basically a 1 to 1.5 inch needle. This one is a 22 gauge, and we have a 3 ml syringe. And what you can do, you can usually get them when they're in lateral recumbency, or you can do it when they are in ventral dorsal, or you can get it when they're standing up. But in this we're going to get in this position today. So I'm going to isolate the bladder. So I'm going to get my syringe, and what you're going to do is make sure you do one stick and draw up. You do not want to go fishing around, because you could damage any other possible organs that are there.
So when we isolate her bladder, sorry baby, she is sedated, so she necessarily doesn't feel all of it. It's a little bit more comfortable for the patient. So we're going to go in. That's as much as she's going to give us.
Come out, and we got our sample. Now I'm going to get a red top tube. We might need more later, so that way we can send it off to the lab and get our culture and urinalysis done.
So we're going to be placing a urinary catheter, and I'm here with Marissa Aguilera, and I'm Dr. Karen Smermal at Sanford Oaks, and the first thing that we'll do is we'll go ahead and measure it to get an idea of how much we want to be on the outside, just to the point of bladder placement. So for this male dog, I've got about this much that's going to be outside. And again, I'll put it in to the point of drawing urine. And we'll go ahead and exteriorize the penis to clean it first. So we'll sport the os penis from caudally, and we push it forward and then take the prepuce and push it back caudally to exteriorize. And we're going to go ahead and just clean with a little bit of iodine. Okay, and then finish off with a little alcohol. Okay, and then we'll cut the urinary catheter so that I won't have to, I'll only be touching the outside of it. So I make a little finger place for me. Hold this and pop this off. Open, and I'll open it with a sterile needle. And I'll have a little drape here. We'll lubricate the tip. And then here I can move it without having to actually ever touch the catheter until we've got a lot of it inside. And at this point, we can go ahead and release the penis. And I'll probably need to cut the end here. We just did a cystotomy, so we're expecting bloody urine. This dog just came out of surgery, so probably has an empty bladder, but the technique would be dispose of the first few milliliters, and then we'd take the sample after that to send to the lab. So to remove the urinary catheter, we just gently pull.
I will be doing a fecal flotation. So what this requires, of course, is your 2 grams of feces. So here I have it inside a fecalizer. The fecalizers are very nice because it'll automatically strain it in there for you whenever you put the solution inside there. If you don't have a fecalizer, you could use a gauze to strain through after you do your mixture with the feces and the solution. So what I'm going to do is go ahead and get my fecal solution and place it, put just a little bit inside the fecalizer, and then I will move it around just to get a nice little mixture of this feces and the solution. And then I will fill it up the rest of the way. Then you can go ahead and place a cover slip right on top of it. So then you'll leave it sitting right there for about 10 to 15 minutes, and then you'll come back and look under the microscope to see what parasites there are, if there are any. So my fecalizer has been sitting for 10 minutes now, so I'm going to go ahead and get the cover slip off and place it onto a slide. So put it onto there. We're going to check under the microscope to see if we notice any parasites. So this is the most common one that's used. And you're going to start off at the 10 times magnification. So I don't see any parasites on this slide, so this patient's negative. Next, I will be doing a process similar to just a regular fecal flotation, but this one will be centrifuged. So, of course, you'll need your fecal sample. You're going to get about 2 grams of sample, and then you will put some fecal solution inside and make a nice little mixture of it. Next, you're going to get your tube that you're going to put in the centrifuge. You are going to strain it as well. I've got that into the tube. Notice how there's no chunks inside. And this will help with the eggs when they float. So fill it up the rest of the way. Close it off. Normally, if you have a centrifuge meant for fecals, you can fill it up all the way to the top, make a meniscus and do a cover slip, and then you can centrifuge it. But ours isn't made for fecals, so I'm going to close it, leave a little space, and then of course get an equal tube for it, and then you're going to go ahead and centrifuge it at 5 minutes. So it's been 5 minutes, and I just finished spinning down our fecal floats, and all we did was just put the mixture that we made in a separate cup. So now what we're going to do is fill it up to create a little meniscus at the very top. And then we will get our cover slip, place it right on top, make sure there's no air bubbles, and then you'll leave it sitting for 10 to 15 minutes. So our sample has been sitting here for 10 minutes now, so I'm going to go ahead and get the cover slip and place it right on top of the slide. There we go. And we're going to look under the microscope to see if we notice any parasites. Alright, I've looked through the whole cover slip and I do not see any parasites, which is good for the patient. I will be doing a direct smear for fecal testing. So what you're going to do is get a small amount of your feces. And place it onto your microscope slide. So you're not going to want any big chunks because you're going to have to be able to see through it. And you're going to get just a couple drops of your fecal solution. Oh, that one's a bit much, but you're just going to make a homogeneous little layer here. Take out any big chunks that you might have. And this one is nice enough to where you might be able to see the protozoan of Giardia. Sometimes Giardia is kind of hard to see because it has such a high specific gravity. But this one you may be able to, but you may not be able to see as many other parasites. So we're going to take a look at it. We're going to start at 10 times magnification. You can sometimes go to 40, but usually 10 times magnification is all that's needed. No parasites were seen, so this patient is negative. I'm going to be doing a sedimentation test for fecal testing, very similar to the fecal float with centrifuging it, but this one is normally used for really heavy eggs, specifically to large animal testing. So I'm going to demonstrate it. So of course you'll need your 2 grams of your feces. So put this in here. And we're going to make a nice little mixture with some fecal solution. And next you're going to strain it through some gauze or cheesecloth. I'm going to use gauze here. because we don't want any of the big chunks to get in there. So I strained it through now. Dispose of that. You're going to fill it up the rest of the way with some fecal solution. We're going to close this off and go ahead and put it in the centrifuge for 5 minutes. So I just finished spinning this for 5 minutes. So what I'm going to do is take off all of this, and I'm going to need some of the sediment to put on the slide. You don't want to disturb any of the sediment in there. So I will be placing a small amount of the sediment on the slide. And now I will go ahead and put a cover slip on it and look at it under the microscope. Sedimentation, as stated before, is used in large animal often. It's also used to look at flukes, because they can be hard to find because they are so heavy. So nothing is out of the ordinary here. I don't see any parasites at all. So this one is negative. This is Brinkley. We're going to do an ear cytology on him. He's been itching, scratching his ears, so you're going to need 2 cotton swabs, 1 for each ear. It's good to do both ears, just in case if one has it, say for example they're not showing necessarily signs in that ear, but it could be early within the yeasty phase or something. So if you do both, it's really good because you can catch it early. And you don't want them to come back later and have to do the other ear, so it's always good to do both. So you're going to go down into this ear here, and you're going to get a good swab. And their ears are in an L shape. We're going to do the other side. Go straight down, roll around a little bit so you can get a good ear swab. You're doing so good, Brinkley. There you go, you got your sample. Alright, so here I have my ear cytology. Here's the left ear and here's the right ear, just that I received from Brinkley. So I'm going to get my ear slide, and I'm going to do the left on top right here, just gently roll it on there. Here is the right one. I'm going to put the right side on the bottom. So that way when I look at it, it'll be left and right. It'll be flipped for you, but when you look at it this way, it'll be your left and your right, and also the patient's left and right. I'm going to clip it. I'm going to briefly heat fix it, and then wipe the bottom. Make sure you know which is the top and which is the bottom, so that way you don't lose track and you don't rinse off the wrong side or anything like that. You're going to do about 10 dips for each one.
Now I'm going to rinse off the silicone clip. And dry it. Put a clean page in here. Press down ever so slightly. Perfect, now it's all dry.
You want to get your immersion oil. So I'm going to go between the 40 and the 100. I'm going to place 1 drop on each sample. And it should click right into place, and you should be able to see it pretty well. You may need to use your fine adjustment just a little bit. I've seen 1 yeast so far. They're very sporadic, and that's the only thing I'm seeing right now is yeast. So I would say this patient has, less than 1+ yeast. Let me go to the right side. So far the right's looking the same way, less than 1 plus yeast. I don't see any cocci, no rods. So yeah, this patient has yeast in the ears. I'm going to next demonstrate how to do fungal testing. Here we have nibbles as well. She has some hair loss going on. She also has lesions here and there. Where this I have here is DTM culture. I also have a pair of hemostats so I can get some hair follicles and put it into the culture, and then that way we can see if there's anything growing. Usually what you can do with these is you can check to see if a patient has ringworm. You can also use a toothbrush or a sterile swab to get a sample, but in this case we're going to use hemostats so we can get those hair follicles in there. So you want to pull around 20 hairs or so, maybe, and you want to get the hair that's around the lesion rather than in the middle. So we're going to go this side. There we go. We're going to open this. So as you can see here, I'm going to place it inside and ever so slightly press against because you want it to make sure it gets in there. You don't want to mess it up, but just enough to where it sticks. There we go. I'll just close this a little bit because if anything starts to grow, you need for it to get some air at least in case if it expands somehow. These are glass, so you're just gonna twist it a little bit. You're gonna leave it in a dark, cool environment. We're gonna leave it in there for a week. I'll check back every day and see if it starts to grow or change colors or see what it does. I've been checking the DTM one, and there doesn't seem to be any growth, no change in color, nothing of the sort, nothing that would, that would be worthy of, checking under the microscope. But of course, if there were any changes within it, we could do a wet prep slide to see exactly what we can, if there is any yeast, for example, that could be something that we could look at. So normally what you would do is you would get some clear cellophane tape. You would go in with sticky side. So we go in, get a little sample in there, come back out, and then we would put a drop of cotton blue stain on here. This would act as your cover slip, which is why you need the clear one. You would put it down on there, and then you would go to the microscope, look on the low power field, and then you would look for any yeast if there were any that appeared. And then you can help determine what exactly could be growing on here. But of course, like I said, this one had no changes whatsoever, it stayed the same. So this one is native. I'm going to demonstrate how to do a skin scraping. So here we have nibbles again. We are going to, she just has a little bit of hair loss, but we're going to go ahead and get a skin scrape and see if there's any possible mites or demodex. First, what you're going to do is prep your slide. You're going to put a little bit of mineral oil onto here. And you're going to get your blade, your dull blade, put a little bit mineral oil on there as well. You're going to go to the location as to where the hair loss is going. So we're going to get a sample right here. When it comes to getting a sample, you have to make sure it's perpendicular to the lesion. Also, you're going to be just gently scraping perpendicularly enough to where you get some red blood cells underneath the microscope. She'll be bleeding a little bit, and then you can stop. So we're just going to ever so slightly perpendicular, just keep scraping until you start to see it turn red and bleed a little bit. So now you can see it on the blade a little bit. scrape it onto here. So that's the only spot we're gonna get it from. So now what I'll do is I'll go and take it to the microscope. So what we're gonna do is turn on our microscope. I'm gonna put this underneath. You're gonna start at your lowest power. So here we're gonna start at the 10 times magnification. And normally you'll be able to see any demodex or mites at this power level. So let's see. We're gonna zoom in.
Just gonna go through very briefly.
So basically demodex looks like a little, I guess you could describe it, some people describe the shape as a cigar, or it just looks like a normal worm just with little ridges on the side. Mites will sometimes, we say that they wave at you or they're dancing. They have their 6 little legs and they're moving around a lot. And from the looks of this skin scraping, it seems to be negative. I don't see anything at all. And that's how you do a skin scraping.
It's recording.
And, oh, okay. This is Dr. Karen Smirmall, and we're going to do a necropsy today. This is our deceased kitten here. So first, of course, we'll need our protective equipment. So we have our gloves, we have our mask, we have our hats, and we have our gown as well. We want to protect ourselves.
First of all, we'll do an external exam to see for any bite wounds, any evidence of trauma. So we'll check for bleeding from the mouth. If we didn't know the cause of death, we'd be checking over the body to give signs of cause of death. So I'll start with a midline incision. And we'll be looking at both the thoracic and the abdominal cavity, going through each system. So coming up through the abdomen,
And through the thoracic wall.
and we'd be checking for fluid in the thorax, any pleural effusion. We could start all the way through the respiratory tract, looking for fluid in the trachea, removing that part, examining the heart, going through valves, seeing these look like healthy lungs, healthy heart, intact diaphragm, going through the liver, examining the lobes, looking for any cancers, again on an older animal if we didn't know the cause of death, going through stomach contents, and going through each of the, starting from the duodenum, jejunum, ileum, down through the intestinal tract and the large colon, going through each of the systems. And so for our sample, why don't we take an example of we could do the liver. Now since it's a small animal, I might just use my scissor. If we had concern about a segment of bowel and we thought maybe that was some cancer, we could take a segment there. So this could be a segment of bowel sent for histopath.
Samples, I'm gonna go ahead and label the jars. So here we're gonna put the date, patient name. This was a stray cat, so we can just put stray. We don't have a date of birth because we're not quite sure, but she is pretty young, she or he. And then specimen or source. This first one was the liver, so got that one. And then here's that stomach one. So again, today's date, patient name, stray, specimen or source. We'll put the stomach, part of the stomach or intestines. You can just put it there. And then we would send these off to the lab. So now they're properly labeled. We have our samples. We'll get an answer from the lab, and that's a necropsy. So when it comes to a rabies suspect, the only people that should be able to handle it is anybody that's been pre-immunized with rabies vaccine as well. Also, when it comes to handling a specimen, you want to wear double gloves. You also want to have your mask on. You want eye protection as well, and you're also going to want an apron on because you want to protect yourself from that potential exposure. When it comes to larger animals, you're going to want more protection, so you can even put on some boots. Just a more protective apron, rather basically a whole gown would be best rather than just a simple plastic apron over your uniform. Also, when it comes to a rabies suspect, if it is a canine or feline, you're just going to want to send off the head to the whatever lab is needed. We send ours to university. The process for handling that specimen is you need to get a styrofoam container that is made for shipping, so that way it can handle any impact that it gets within the shipping process. Usually they're overnighted, so they're not, in the mail process for very long. Also, when it comes to putting the specimen inside the container, you're going to want to use ice packs only, no dry ice. You never want to freeze the sample. You're only going to put the specimen within a bag, and then ice packs all around it, and then inside wrap it around with some newspaper. You can even put some towels, but just enough for it to make it through the shipping process. Especially in the state of Texas, it can get really hot. Luckily it's overnighted, so it's not in the mail, like I said, in the mail for too long, but just enough to where it stays cool enough for 48 hours or so. And those ice packs really help out. And also you'll be having some paperwork, some forms that you'll submit with it, so you just put that into a box and into the whole shipping container, and then you can send it off to wherever you need to send it off to. And with the rest of the body, you need the way to dispose of it. You're gonna double bag it in a biohazard bag, a red biohazard one, and you're gonna dispose of it as if it is a biohazard, specimen basically, rather than just any normal cremation process. You can dispose of it in that sense. I'm going to demonstrate how to do a vaginal cytology. Here we have is Nibbles. She's quite sedated, so it'll be fairly simple just because it's not an easy process. It's not very comfortable for them either. First, I'm going to disinfect her vulva a little bit. So now I'm going to get my sterile swab. If I can open it. I am going to wet my swab with some sterile saline, just so to make it easier, a little bit more comfortable for the patient. I'm just going to pull here. When you go in, you're going to go up a little bit, and then you're going to go horizontal. So vertical and then horizontal. So you're going to go up, and then horizontally, and then you're going to roll around just a little bit, get a sample, and then come back out. You're going to get your slide here, and you're going to gently roll out onto your slide. You don't want to push too hard, mess up any cells that are there. So I just received my sample from my vaginal cytology. I've let my sample dry out now onto the slide. So now what we're going to do is we're going to stain it so that we can look at it under the microscope and see what we're looking at. We have specific stains for these sterile cytologies, so that way they're not mixed up with our ear swabs. So we're going to do about 10 dips each one.
Scrape off any excess stain onto the next. I'm going to rinse this off really quick. I'm going to dry it out. Let the paper absorb it. Gently press on it, you don't want to break the slide.
Now we can take a look on the microscope and see what we're looking at, about which stage of estrus that the patient is in. So again, turn on our microscope. Start at the lowest magnification, get to focus on it.
Onto the forehead.
So far, I'm not seeing very much. I'm seeing quite a bit of parabasal cells. Yeah, not much to it. So this patient is most likely in anestrus. Yep, just a bunch of parabasal cells. So there are 4 stages of estrus. So there's anestrus, there's also proestrus, there is estrus and diestrus. So basically what each stage means, when the patient is in anestrus, there you can see a lot of intermediate or parabasal cells. You can also see sometimes when they have no behavior signs, so you can't really tell that they're in heat. There's no, vulva swelling, there's no discharge from the vulva. There's also proestrus. So what that means is the uterus is starting to enlarge. There's some red blood cells that start to show. The female, usually the males will be attracted to the females, but the female will not stand for the male. Usually this phase lasts around 2 to 3 weeks or so. Also on the slide you can see some intermediate, you'll see some parabasal, and you'll also see super epithelial cells, sorry. The next stage is estrus. Also, that's the point where you really start to see the vulva swelling. You really start to see also some drainage from the vulva. You'll definitely see a lot of red blood cells under the microscope. You'll also start to notice that the ovulation is occurring. You'll also be able to see some superficial, superficial cornified. So basically what that means is sometimes you'll see really sharp edges within the cell, and usually the females will definitely stand for the males. And also there is diestrus. So this is when everything starts to go away, and you'll see a big difference within the red blood cells. You'll see little to none. You'll also see more of the intermediate cells and back to the parabasal cells. So that's why sometimes people have trouble differentiating between the diestrus and the anestrus, and that will usually last 2 to 3 months, and then the whole cycle starts again. And that's how you determine the stage of estrus in a patient, and those are the cycles of it. I'm going to be demonstrating a cross match, 2 EDTA tubes. So here I have mine labeled, one recipient and donor, and they're color coded as well. And I also centrifuge them so that way I can get the plasma. And I also got some serum from both the recipient and the donor as well. So I have those ready for me. And I've already spun down both the EDTA tubes, so you can kind of see there. We're going to decant the plasma that's in here. So we're going to go ahead and take this out, get rid of it because we do not need it. We're going to go ahead and do the same with the recipient. Carefully take off the top of this one. And so now, as you can see, we went ahead and took that layer of plasma off. Our next step is to do the washed erythrocytes. Get a new tube, plain tube, and we're going to put 2 drops of the red blood cells. We're going to do the same for the donor. You can see donor on there. So next step, what you're going to do with these 2 is you're going to fill it up with some saline solution. So mix them both, and then you're going to put them into the centrifuge. You're going to spin them for 1 minute at 3,400 RPMs. Okay, so they just finished spinning for 1 minute, and this is what it looks like after spinning down. So you can see all the red blood cells at the bottom, and it should be clear, colorless at the top right here. So you can see it on both the recipient and the donor. So you're going to want to do that 2 more times. So that's a mixed total of being washed 3 times. So I'm going to go ahead and do those other 2.
You don't want to disturb any of the red blood cells at the bottom. Did that for the recipient, now the donor.
Okay, so we're going to go ahead and do that 2 more times for both the recipient and the donor. So we got our saline in here. Fill it up the rest of the way. So here is after our second wash. So still red blood cells at the bottom after they've been spun down for a minute at 3,400 RPMs, and still colorless at the top. So once again, decant the supernatant.
And then we're going to do this more and more time. So recipient done.
Okay, so you'll get 2 drops of the sample at the bottom, put it into a new tube, fill with saline again, and you'll wash them for the 3rd time.
So, add some saline.
Invert and do it for the 3rd time. So here is after our 3rd wash. So what you're going to do after the 3rd one is different. So you're going to want to make an erythrocyte suspension. So what I have here is 2 tubes labeled suspension on them, color coded to match with recipient and the donor. So what you're going to do is first, of course, decant the supernatant of each of the washes.
Washes. Same thing with the donors.
Okay, so now all you're left is with the red blood cells at the bottom. And to make that erythrocyte suspension, you're going to add 0.02 cc's or mLs of the donor's red blood cells, 0.02,
We might get a little more, so go to 0.02.
and you're going to put that into the suspension tube, labeled suspension. So very little, it's not going to be very much. And then you're going to fill up with 0.98 mils of saline. So we'll get our 0.98 in here. And you're going to put that 0.98 mils of saline in here. So 0.02. And again, 0.98 of saline. So both of them will look like this. Okay, so now comes the time when you're going to do the actual cross match. There's the major and the minor. So first we'll start off with the minor cross match. You're going to put it in a tube labeled minor so you can keep track of which is which. So what you're going to do is get 2 drops of the donor's serum. So donor serum, get a sample of that. Into the minor tube. Here's 1 and 2. Perfect. And then you're going to get the suspension of the recipient. So recipient suspension here. You're going to put 2 drops of that into the minor. So 2 drops of recipient suspension. 1, 2. And that will create your minor cross match. So you can see it's labeled minor. And now you're going to do your major cross match. So this one, of course, labeled major. 2 drops of the donor's suspension. One, 2. Perfect. And 2 drops of the recipient serum. One, 2. So now we're going to be doing the controls for both the donor and the recipient. So you're going to do 2 drops of both the suspension and the serum.
So, here is the serum and suspension. 2 drops into one and 2 drops for the other. So first we'll do the donors. 1, 2. And then we'll do the suspension. So 1, 2. That'll be your control for the donor.
And now you're going to do the control for the recipient.
So here's our serum and our suspension. So 2 drops of the suspension. 1, 2. Now the serum. 1, 2. Perfect.
So what you're going to do next is you're going to centrifuge all 4 of them, and afterwards we'll check for any hemolysis within the tubes. So here I have both the minor and the major cross match, so there may be some hemolysis going on. However, I can flick it to see if there's any agglutination, and there doesn't seem to be any right away. So what I can do is go ahead and check both of these under the microscope.
First I will get the measure. Get 1 drop sample. Place it on here. And put a cover slip on. That one is the measure. Then we can get the minor. And put 1 drop there. And put a cover slip as well.
So there's the minor and the major. And now I will check under the microscope on a low power field, of course. So switch over to the 10 times magnification. So I've checked both samples, both the major and the minor, under the microscope, and I didn't notice any agglutination under there. So since I didn't notice any agglutination within both samples, both microscopically and just looking at the tubes, they are compatible for transfusion. Usually if there's slight hemolysis, it's not a huge deal. It won't make a difference in the blood transfusion. but you definitely want to keep an eye out for that agglutination within the samples. But these are compatible, and that is how you do a cross match.